Hey, this is Mrs. Reichelt, and thanks for tuning in with us. This next video is really a quick one. We're basically going to go over the respiratory disorders, not all of them, just a few of the most common one. So this first one is the chronic obstructive pulmonary disease, or COPD. So COPD is exemplified by chronic bronchitis and emphysema. It's one of the major causes of death and disability in the United States. The features of the disease is as follows. So patients have almost always have a history of smoking. They also have labored breathing. That breathing becomes progressively more severe. Labored breathing is called dyspnea. So just be aware of that. Coughing and frequent pulmonary infections are very common with COPD patients, and most victims are hypoxic, meaning that they don't have as much oxygen in their bodies. They retain carbon dioxide, and they also have respiratory acidosis. So hopefully this makes sense. If you are hypoxic, that means you have low oxygen levels. If you have low oxygen levels, then that inversely means that you have higher carbon dioxide levels. If you have higher carbon dioxide levels, that means that you have a lower pH because carbon dioxide is acidic. So that means that you would probably suffer from respiratory acidosis. The people who are infected with COPD will ultimately develop respiratory failure. Another respiratory disease or issue that can occur is called HAPE. HAPE is high altitude pulmonary edema. This occurs at high altitudes. It is not a very well understood issue or ailment. Basically what happens is the alveoli membranes will leak fluid, and that fluid will fill the lungs, which can cause death. So remember from a couple of videos ago, your alveoli kind of almost looked like grapes we'll just draw them like this. So basically you have part of your bronchioles, tubes, and then you have your alveoli. So basically what happens here is that fluid leaks out and it fills your lung with fluid, which ultimately means that you could basically drown in your own fluid tissue. Okay, this occurs most commonly at high altitudes. It is believed that the fluid begins to leak as a result of hypoxia. We just talked about hypoxia on the last slide. That means you have low oxygen levels. Okay, if you have low oxygen levels, then you're also going to have probably higher carbon dioxide levels, which would mean that your blood is a little bit acidic. So that HAPE is really where fluid is filling up in your lung surfaces. Okay, the quickest solution for patients that have HAPE is to get off of that mountain or get to a lower altitude or elevation. Another respiratory disorder is chronic bronchitis. This is where the mucosa of the lower respiratory passages become severely inflamed. They produce a whole bunch of mucus, and that pooled mucus will impair ventilation and gas exchange. That means that you can't efficiently get carbon dioxide and oxygen loaded and unloaded because of that mucus. You do run a risk for lung infection. Pneumonia is very common. Sometimes this is called the blue bloaters because it's due to hypoxia, which is that lower oxygen levels, and the cyanosis that can occur as well. Another respiratory disorder is emphysema. Emphysema occurs when the alveoli are enlarged and the chambers will break through. This is a chronic inflammation that promotes lung fibrosis, so your lungs get really, really damaged. Typically, the airways are going to collapse during the expiration. So as you're exhaling, airways collapse. This prevents the patients have a lot of energy. It takes a lot of energy to exhale a breath because their airways are constantly collapsing. So overinflation of the lungs will lead to a permanently expanded barrel chest. So people typically have a larger barrel chest because they're taking in too much oxygen at once and then they're not able to get rid of it. The cyanosis appears late in the disease. Sufferers are often called pink puffers, so just to be aware of some of that terminology as well. And then the last slide here, a closer look at lung cancer. So this is a picture of a healthy non-smoker lung. So this is a non-smoker, and this is the lung of a smoker, and you can just tell the difference between the carcinogens that you're putting in your body versus somebody who is not. So this accounts for 1/3 of all cancer deaths in the United States. And there's an increased incidence with smoking. And then there are 3 common types of cancer here. You have the squamous cell carcinoma, the adenocarcinoma, and then you have small cell carcinoma. So those are certainly not all of the respiratory diseases that are associated with this system, but certainly probably the most common. Hope you found that helpful.